Hey everyone, welcome back to Pediatrician Brothers. I'm Dr. Konstantin.
And I am Dr. David. Today we're gonna tackling a huge topic, recurrent infections in infants and children.
You know, parents often worry when their children seem to catch every bug around, but we're gonna talk about what is normal and what needs deeper look.
We'll walk you through our step-by-step approach, highlight warning signs of an immune problem, and explain when to call a specialist.
Let's define recurrent infections. We call it recurrent infection when child has 2 or more serious infections in 1 year, 3 or more respiratory infections like sinusitis, ear infections, bronchitis in a year, or needs antibiotics for more than 2 months per year.
And serious means that they are severe, long-lasting, or complicated. For example, needing IV antibiotics or even hospitalization.
When child has recurrent infections, we sort them into 4 categories. The normal child, who is perfectly healthy and immune system doesn't have any problems. Second, the child with atopic disease like allergies, asthma, eczema. The child with another chronic condition like cystic fibrosis, reflux, heart defects, and etc. And the child with an actual immunodeficiency with primary or secondary one.
Most kids fall into first 3, only about 10% have a true immune deficiency.
But how do we spot that 10%? Here are top red flags for the parents and physicians. Family history of early death or known immune deficiency, failure to thrive, such as poor weight gain or growth, need for IV antibiotics or hospital stays to clear infections, 6 or more ear or respiratory infections in a year, 2 or more serious sinus infections or pneumonia in a year, recurrent deep skin or organ abscesses, which are very rare in normal children, infections with unusual bugs or locations, and complications from live vaccines like MMR vaccine and etc., chronic diarrhea or non-healing wounds, persistent lymphopenia on lab tests.
In infants, also watch for low calcium seizures, congenital heart defects, no thymic shadows on chest X-ray, or umbilical cord that won't fall off.
Let's start with normal child. They may get 4 to 8 respiratory viruses a year, that's an average. If they have older siblings or go to daycare, this number can go to 10 or 12.
They usually bounce back, grow normally, and only get 1 pneumonia or 2 uncomplicated ear infections in first 3 years. Their labs and exams are normal.
Next, the child with atopic diseases. Allergic rhinitis, eczema, or asthma can look like recurrent infections, especially sinusitis or bronchitis that do not respond to antibiotics but does to allergy meds.
Look for allergic shiners under the eyes, a nasal crease, and elevated IgE on labs. But remember, atopy and immune deficiency can coexist.
About 10% have chronic disease like cystic fibrosis, reflux or aspiration, congenital heart disease, and anatomical defects.
These kids often have poor growth and specific exam findings. Their infections are usually tied to the underlying condition.
Finally, let's talk about immune deficiency, which is about 10% of referrals. These can be primary genetic inborn errors of immunity, secondary from HIV, diabetes, chemo, etc.
Primary immune deficiencies often represent in early childhood and affect B cells, T cells, phagocytes, or complement system. Over 400 distinct disorders can exist.
Every parent and doctor should remember that child's medical history is everything: birth history, growth, immunizations, family history, especially consanguinity, social exposures, and detailed infection history, age of onset, frequency, and which organism was causing the infections.
On exam, look for failure to thrive, dysmorphic features, absent tonsils, eczema, clubbing, lymphadenopathy, or splenomegaly. These clues can guide your workup.
First, we'll start with CBC and differential, chemistry panel, ESR CRP, urea analysis, and measuring the levels of immunoglobulins.
Pay attention to lymphocyte counts. Lymphopenia is a red flag. Low IgG or combined low immunoglobulins suggest humoral immune deficiency.
So if labs or clinical features point to immunodeficiency, we need to refer to an immunologist, and they might need flow cytometry, measuring the complement system, also genetic testing, and we might also need to measure specific immunoglobulins against the vaccines that were already received.
Yeah, and we should remember that SCID is a pediatric emergency, so evaluation of the pediatrician is important.
Goodbye. Thank you for listening to this video. I hope you enjoyed it. Please put a like on this button, subscribe to our channel, and comment if you are interested in any other subject or you have additional questions in this regard.
I hope you enjoyed the video about recurrent infections. See you later.